Hey guys, Dr. John here. Just want to take a quick moment to show you good posture versus bad posture on a couch. We call this couch slouch, and the proper way, firstly, to sit on a couch is with some support. So we want some support behind the back to kind of maintain the low back posture or relaxed posture when we're watching TV or having a conversation. But here's what most people do. They don't use the pillow, and when it's couch time, it's fully relaxation time. So what they do, they just kind of slouch into the couch. Here's the problem. It puts pressure on the bottom discs throughout your lumbar spine and allows your head to come forward. One of the worst postural patterns we see in our office that's most consistent is what we call couch slouch. I want to take a moment now and show you what that looks like on the inside after doing this multiple days in a row and creating a bad pattern for yourself.
Okay, so let's take a look at what happens on the inside when you sit with that poor posture, or what we call couch slouch. So let's take a look at the segment numbers here. So this is the low back. You can see L1, 2, 3, 4, and 5. We're going to just throw some lines on here, the abnormal and normal line. So this green line is the normal arc that the lumbar spine should assume when standing. And what we have here is where this patient is. So you can see that if we do a measurement back here, we can see how far that normal line is off where this actual patient is. So we got a 39.4 millimeter, what we call posterior shift. The other thing we want to really look closely at is what the curve of normal would be, and that you can see over here is 40. This patient measures 22.4, and then the only other measurement we'll look at, even though we do look at other ones in more detail, is this sacral base angle. So this angle relative to the ground should be 40 degrees, and we can see this patient's at 21.1. So we have three metrics. We got a curve, we got a posterior shift, and we got a sacral base angle to all show that this patient is in that assumed posture that we see time and time again in the office. Now, couch slouch is not the only cause of this. It could be sitting at your desk at work, but this is a very, very common cause of low back pain. And we can see this and get measurements of it. The great thing is we can assume that here's the starting point, and then we'll have a goal to reduce this and increase these curves and these angles to more mimic what normal is. When we do that, we find that patient's low back pain goes away, and more importantly, their spine becomes a lot more stable, stronger, they can be more active, and basically get back to the quality of life that they enjoy. So just looking at this in black and white gives us a lot of information and hopefully some motivation to be very aware of your posture when you are sitting, because this right here can lead to, as I said, low back pain, degenerative disc disease, arthritis down the road. We want to prevent all of that and try to stabilize this in a position that is what more considered normal.
So I just want to quickly end with this tip. Just be aware of your posture while you're sitting watching a movie or TV or having a conversation with a friend. Avoid couch slouch. It will help you with your low back pain and more importantly prevent it from ever occurring. So I hope you like this video. Until next time, take care.